Welcome back to the broadcast, the last laps of the show, and Mondays we always talk nutrition and health. So today we'll be focusing on urinary tract infections, commonly known as UTIs. I'm sure when I say UTI, then it rings a bell into your mind. Sometimes we'd say most of the people have struggled with this, especially the ladies out there. And so today we get to learn of the symptoms, how you get to know that you have UTI, and how do you get to address this, whether there can be a reverse of the same, and so much so. We have a specialist on board, Dr. Caroline Mwai, who joins us this morning, and she'll be the person who will take us through this. I always say when it comes to matters health, I leave it to the expert. I listen and get to learn just as you would. So take your pen and your paper. Let's get to learn this morning. And it is open for you to ask all those questions that you'd want to 22047. The SMS short code, the numbers to call 0768095491. Constant reminder on your screens, or you can as well hit our social media platform, #Morning Cafe at Linda_Lela TV47KE. Let's get to ask those questions as we all get to learn this morning. Good to have you, Doctor.
Thank you.
Karibu sana.
Asante sana.
All right, and yes, straight to the point. Just what is this, and how do you get to know that these are the signs and symptoms of UTI, or just how do you get to know that you have UTI?
Right. Thank you so much. UTIs. Most people know about UTI, just generally UTIs. Nobody knows the different types of UTIs that we have around us. But what you do, the doctor can only tell you your class of the UTI that you have, because many people think when you have an UTI, because most of the times the signs and symptoms they almost look like the same,
Okay.
But when it comes to UTI, we have UTIs in different levels and different places in the system.
Right.
Talking about UTI, we are talking about the urinary system. We're talking about infections. Well, the body has a lot of types of infections, but right now we are talking about UTI, urinary tract infection, and by the name itself, urinary tract tells you it is the system, the urinary system, which consists of the ureter, bladder, kidneys, and the urethra.
Okay.
And a UTI can affect you from downside, from the lower side, that is from the urethra and the bladder. When it is extended, it will go to the ureter, the pipes, and the bladder. So we, like the doctors, will be able to know the kind of UTI that you have, or the kind of infection that you have, according after investigations.
Okay.
Why people go wrong is because when you get these signs and symptoms of infections, normally they look alike. You wouldn't be able to know the exactly UTI that you're suffering from. What people do, they will go buy medicine over the counters, and this is why UTI has become a problem, or maybe it has become very stubborn, because people will go buy the medication without having been investigated or maybe tested. So we ask people, we ask whoever maybe is suffering from this kind of infections, please don't go buy the drugs from the counter. Okay, well, the counters are there, and the drugs are there, and they're okay. But the minute you buy the drugs without having been investigated, this UTI will never go away.
All right, so when you speak about UTIs, and that means there are a couple of them that are different, how many are we talking about, and how then, well, in as much as they have almost the same signs and symptoms, how do you get to know that, well, this is UTI in whichever form?
Or maybe just an infection, yeah?
Yes.
We have prostatitis, we have urethritis, we have candidiasis, we have general UTIs, we have PIDs, there are so many to talk about. There are so many, but when you come to me, we do a consultation, or maybe go to the hospital, they do a consultation. The doctor will be able to know where to start from. From the signs, they almost, sometimes they confuse you, like the doctor. But what you do, after the investigations, after doing the tests, you'll be able to know exactly which infection the patient is suffering from. All right.
In most cases, with different conditions or health conditions, you always hear that, ladies are likely to get this more than men and all that. Is such the scenario on UTIs, or, it cuts across? Oh,
it is true. We women, even we speak about we women because we're women, we suffer UTIs or the infections very fast than men. One, because of our pelvic area. It is a bit short, but for men, it is a bit long, the system itself. For a woman, the pelvic area consists of the vagina, the cervix, the uterus, and the fallopian tubes, and the ovaries. I would call it how a woman was created.
Yes.
Or maybe the system of a woman is a bit short. And so, and again, if I may say, we women, our area is very conducive for the bacteria to grow very fast than in men. Right. And so when an infection comes in between two people, in a couple area, when it comes to them, who feels the infection most is a woman.
Okay.
And fast. Yeah.
All right.
Because of how a woman is created, if I may say. And because even the area of a woman, the bacteria will grow fast and she will experience the infection faster than a man.
Okay.
But what I say, I normally advise people when the infection comes in a family or maybe between two people, they're supposed to be treated, both of them. Simply because we women will feel it fast and the man will not feel it fast.
So the moment you're told this is UTI, you make sure that you also bring your partner.
Yeah.
Okay.
Because the minute you treat the woman and the man is not treated, this infection will never clear in the family. It will keep recurring.
Right.
Because the woman is treated, well, the signs and symptoms, they persist. What happens? The man deposits again the bacteria back to the woman. And so the infection keeps recurring. And
how long would it take for a man to realize that they probably have the infection?
A man?
Yes.
A man can take maybe a week or so.
But
for a woman, in 3 days, you already have the feelings and you already have the symptoms. And the good thing with women, they go to the hospitals. Early enough.
Yes, in most cases, women are always out there running.
But with men cases, we have a problem.
They tend to hold themselves back. And speaking of which then, how uncomfortable can it get to a point whereby you probably would speak of a man who maybe is experiencing some of the signs and symptoms, but they still choose not to go? Is it not that bad?
We talk about like symptoms like backaches.
Okay.
Women, when they feel backaches, they have LAPs, those are the lower abdominal pains. They feel they're itchy, maybe there's discharge coming, they go to the hospital. For a man to go to the hospital because he has signs, maybe he has some backaches, he'll talk about, my hustle is so hard. Okay. This is why I'm having a backache. It's not an infection, but in him, he has an infection. But now he wants to convince himself, I hustle so hard, I do a lot of work. Women, we struggle so much. But now the infection is just incubating in him. And it is graduating from this level to the next level. Because the minute the infection is not treated early, it will graduate to something else. So they come when it is already late, they are not able to perform their duties. They are not also, maybe they have some discharge, they have a lot of pain. This is the time they'll come to the hospital. What is the
worst that can happen if it gets to that dire scenario?
In both cases.
In both cases, yes.
It will cause like some chronic diseases. Okay. It also causes infertility, which has become a bother today.
Yeah.
And most infertilities that we are getting, the cases that we are getting in the hospitals, they are just from minor UTIs. Okay. They have graduated, they have blocked the tubes, they have infected the cells, they have infected the ducts themselves. So at the end of the day, you get infections and then you get blocked tubes.
Well, maybe we should have started by asking what would cause UTIs, whichever the form, and are there steps that one can probably take to reduce the chances of getting UTIs?
Sure.
Yeah.
What I would also want to say, UTI. Okay, most people, when they think that I have a UTI, they definitely think, if I go to my doctor, what will my doctor say? You know, they relate UTIs and bad manners.
I know. I mean, in most cases, you would not even want to mention it to your partner.
Exactly, and this is why it is becoming a bother to us, because people don't want to own up, come and say that I have a UTI. And this is why we are coming in saying it is not just about having unprotected intercourse that you can get UTIs. Yes. There are so many ways, especially our personal hygiene, about maybe
the products you use for ladies.
Exactly.
Okay.
That's what I was coming to.
Right.
The products ladies are using nowadays, you don't know what you're even doing, because you just heard about it, you just read about it. You don't maybe you tamper with the part, with the products that you're using, simply because the part, the organ itself, it has its own bacteria. We call them commensals. They're not supposed to be tampered with so many things that we are using. The minute you use those things, you make the organ weak, because you kill even the bacteria, you kill even the white blood cells which are around that area. So what happens? It becomes weak.
Right.
And so any bacteria that comes in doesn't have anything to protect it, the area. So we are prone to infections. Again, if you're diabetic, probably you don't know you're diabetic. Most people, when they're diabetic, or maybe you don't know if your sugars are high, you're at risk of getting the infections, simply because the immunity of the body goes down. And so in case of any bacteria that comes in, it just starts germinating, or maybe inaanza kukua, you know. So what happens? Okay, we were talking about diabetes. We've talked about using, those ladies are using, about our personal hygiene. Let me go back there again.
Intercourse, in a way.
Personal hygiene comes in how we do our clothes, how we hang our clothes. They're supposed to be put outside where there's atmosphere, and maybe this, in case there's a bacteria, it dies all of a sudden, because even that atmosphere has the power to kill some of the bacteria. But what we do, we hang them in the house. So, and we give the bacteria room to grow and to germinate again. And as long as you washed the clothes, there's some bacteria you've left in the clothes, and so they start germinating again. But when you put it outside, the atmosphere, the sun, and the light itself, it can also kill the bacteria. We have so many areas using our toilets. The way we are using, like us ladies, let me just say, the way you're using tissues. There are ways you're supposed to use that tissue, but now people are going wrong. They don't know how to use it. They just use, now you bring bacteria from backwards, forward. So there's a way. We need to talk about this, I think, to women, because a small mistake brings a big problem in the family.
All right. Well, cleaning is key. You spoken about that, and maybe we cannot go deep into that because we still have so much to capture. But in real sense, upon that declaration that you probably have UTI, ladies will tell you they probably want to wash the system proper and clean themselves proper. And even before that, sometimes there's always that pressure that comes along with, you want to feel good, you want to smell good, you want to appear good. So in that case, you tend to go an extra mile in terms of cleaning. But on the other hand, I'm being told that this is a natural system that has its own way of cleaning. What happens in a scenario where maybe you are, in that time of the month, and you probably need to do proper cleaning on yourself to avoid such scenarios, so that you do not do it extraordinarily to a point where, again, you also create a base for bacterial growth?
Whichever the case, you're only supposed to use soap and water, period. And if it's possible, you can just use plain water. You're not supposed to put so many things, because that is why you tamper with the bacteria, the commensals, the pneumophoras in the organ. Right. And so you make it prone to so many bacteria.
Okay. Well, as we drop that one then, one would want to ask, well, what is the best thing to do in the event that it has been declared that you have UTI?
Good. The best thing you're supposed to do is to visit your clinic, or maybe to come to the clinic. We do the test. We do a consultation. We do the test, and maybe from there you can be able to know exactly which drugs you're supposed to use. Please avoid buying drugs from the counters. Well, drugs are okay, and I'm saying this and again, they're okay, but please buy them after being tested, so that we can clear this problem about UTIs.
All right, by just keeping hygiene, maybe after this has caused this, probably the aspect of hygiene was not up to par, and then you ended up contracting or getting the UTI. Is there a way we can have a reverse of the same, where you say the UTI will go away on its own in the event that you now observe the right ways of cleaning, the right ways of hygiene?
The minute the bacteria has gotten in you, it is very hard for it to go away just alone. Okay. There's need for medication, there's need for investigation. But anyway, there are sometimes you can also come to the clinic, and maybe you can try and investigate the kind of infection that we have. It is not a must that we tell you can take this type of drug. Sometimes we can diagnose it. Like we tell you can take this, you can take this, you can eat this, you can take a lot of water. Maybe it's not very serious. No, but unless the doctor has done it herself, please just don't do it alone. Okay. Yeah. All
right. We speak of urinal aspect of it, and I think then urine has to come in. Just how much on average would one of urine would one pass in the scenario that they have UTI, or what are some of these other notable things that will have some level of adjustments in your body?
The minute you see maybe you're having frequent urination, drops of urine, maybe you have to pee after a long time, and then you pee very concentrated urine.
Okay.
This is where the doctor comes in. Maybe when we're doing investigations, we'll also have to check on the urine, the amount of urine you've given us, type, color, and maybe we do some more tests, because urine is supposed to be clear and maybe just a bit amber.
Yeah.
Sometimes they'll be cloudy, it will be red in color, it will be green in color, it cannot be also in yellow in color. It is now me who will be able to tell you the kind of infection that you have, if it's cystitis, which has come from the bladder, simply after doing my investigations.
Okay.
But the color of the urine and maybe how you're passing it, because some people will complain about pain when you're passing this urine, when you're starting, when you're finishing. I will be able to tell you the kind of infection, but the minute you have any complication in the way you're urinating, please just come to the hospital.
Okay.
Don't take it for granted.
All right.
Yeah.
We have mentioned a couple of reasons or causes that would get one getting UTI, and equally we have acknowledged that there are different types.
Yeah.
Are these reasons, ones that would cause, UTI in whatever form, or there are specific ones for specific, forms of UTI, and which would be the most prone one that, when you say you go this direction, automatically you cannot escape getting UTI?
Well, the causes of the kind of bacteria that we get when UTI comes along, it can be parasitic, it can be bacterial, it can be fungal, but the most that we get, it's a bacteria called E. coli.
Okay.
The E. coli bacteria, it is just all over, in the toilets, in our clothes that we are wearing today, on the surfaces. But that is the most bacteria that is disturbing us. But anyway, when you come to the clinic and we do the investigations, we'll be able to know the kind of drugs you're supposed to use. Yeah.
Okay, so in this case, what would be the most UTI risk factor, especially in adults? And is such an experience also on young tots?
Our behaviors.
Okay.
Yeah.
All right.
That comes in. Because when you have multiple partners, we have unprotected intercourse, most of them comes in handy. And now this is why you hear people don't want to come to the hospital, because they don't want to tell facts, what I did. And again, also, maybe using the toilets today, public toilets, again, about our personal hygiene.
Yeah.
But anyway, whichever the cause that has brought about that infection, please don't worry. It's good to go to the hospital. Yeah.
Is that then to mean that children can as well get this?
Yes, they do.
And how do we approach it in terms of the medicines, in terms of how we get to handle them? Is it a whole different in comparison to what the children will be done for and the elderly?
Oh, children,
the
yes, especially these young people. I believe also talking to them as parents, counseling them. Well, counseling is also done in school, it's also done in churches, but us like parents, we need to come in. We need to come on board, talk to them, tell them if maybe you go outside the outside world, how you're supposed to use these toilets, how you're supposed to be, your personal hygiene, how you're supposed to interact with other people. We also need, as much as we want to finish this problem, we should also talk to them and make them know the reality. Yeah.
Okay. To prevent this, on several occasions I've heard that, liquids are important. Let's speak of water. Is it true? Or are there specific liquids that one would be encouraged to take or be recommended for, so at least they get to avoid getting UTI? Yes,
we recommend people take a lot of water. A lot of water helps because you will urinate much. And the much you urinate much, you also wash your system. Your kidneys, we also have a chance to filter the urine well, because it is not very concentrated. And again, we also advise people to take yogurts. Yogurt is also very good because it has some cultures, and these cultures also kills the microorganisms which are in the urinary system when you're passing the urine. Yeah. All
right, so these are natural yogurts or just general yogurts, because you find that a lot of things have been incorporated in the yogurts that we take today. So can one be confident that, well, if I'm doing my strawberry, my vanilla, I'm doing, my caramel with water yogurt, I am safe?
Yes, you're safe, because what you're looking for, it is the culture that has made that yogurt. Maybe being plain, or maybe it has some flavors. Yeah, we need that culture.
Right.
Yeah.
Okay. Pregnant women. This is also very common for them, and sometimes they probably do not tend to understand why this is happening. Some of them at that point, maybe they're not sexually active, and so in such a scenario, just what percentage of women, first of all, would get UTIs, and what would inform this? And how then do they handle, or how do you handle them as a doctor? Because you realize that also most of them are discouraged from taking medicine out here. Yeah.
Sure. Pregnant women, most of them, we have cases of urinary tract infections. This comes, or sometimes it comes automatically because, you can get a bacteria from outside. This is it is okay to get a bacteria, because the minute you get a bacteria from outside, you have the bacteria in you, the commensals in you, and the pneumoflora in you, which are supposed to eat that bacteria and make it die and just get out. But now, for a pregnant woman, what happens? Her immunity is very low. Remember, now her immunity is being shared by 2 people, so it is very low. So in case a bacteria comes in, most of the time it tends to grow, and maybe it's tends to become an UTI. But what we say, because if you keep it and you keep quiet because you think it's just normal, you might infect the baby during childbirth. So what we do, they come to the hospital, they have the specific medicine they can use, because they just don't have to use any type of medicine without being prescribed by the doctor, because it can also cause some problems like miscarriages and all that. But now, with pregnant women, it is very common and it is allowed, I would say that, because of the immunity level, it has gone down. But the minute you get that type of infection, most of them complains about it. The minute you get that any kind of infection, please go to the hospital. Don't buy drugs without being prescribed by the doctor. Yeah, please.
Okay, I bring you back to the men, and someone is actually asking a question here. Well, it's not really common for us to be, unhygienic as men, and sometimes actually this does not affect us hugely. So what are some of the other things that can hugely prompt urinary tract infections on men, and away from intercourse, and generally the aspect of hygiene is not really bad for them, they say?
Personal hygiene.
Personal hygiene.
Yes.
Just how instrumental is this for men? Because they always tell you, even infections like HIV and AIDS, the percentage of them getting is way lower than that of ladies. And I think you've already expounded that.
Sure.
But then, is it really much of a factor when it comes to them not having proper personal hygiene?
Oh, it is very hard for you to see a man maybe going to hang their clothes outside.
Yes.
Very hard.
Yes.
And so they like putting their life so.
Sometimes they do it weird actually, and they just take an iron box and
Yeah, exactly. Men, I don't know why they are just shy. We women, we don't have much problems.
Is it carelessness of being shy, honestly?
I don't know.
Shy is the word, probably.
They are very personal. They don't want to do it. They don't want to do it outwardly. They want to do it. I don't know where I can say. In fact, even when a man has an infection, before he comes to the clinic and before admitting that he has an infection, that is the most difficult thing. And again, this is what I'm saying. He's supposed to hang his clothes outside and shower. Men, I don't know, they think women are supposed to shower more than
them.
Yeah,
true.
They're supposed also to have the personal hygiene with them and shower enough times, just like the women do. And again, how they handle themselves also matters.
Well, and speaking of which then, as you come to the doctor, in most cases you find that there's that level of fear on speaking out and everything. At that level of, a doctor's level, and a professional's level, a counselor's level, and all that, what is normally done to make them come around and understand this is not something that really should worry you a lot? Because, I have seen people who keep taking medicine because, the house is full, and so the only way they can take medicine is in the presence of people, and now people will start questioning, are you sick? Why are you taking that? And now how do you get to explain this? So how do you get people, to that level where they're comfortable speaking and they're comfortable coming back and again to just find out whether they are now well or not?
Men, they love themselves so much. I think you have to handle them very well when they come to the clinic. Make him feel at home, and then maybe he can be able to talk. You don't have to take him. You take him slowly, he will talk. And then you talk to them, let them know it is not an offense to have an infection. It is not an offense to be sick, because they believe they're not supposed to be sick. But when they come to the clinic, he will come with a case, and maybe he doesn't want to talk about it, but you bring him on board, and then he'll finally talk about it.
In the scenario where they come in as couples, And so there's that pointing of finger that probably you're the one, and you're the one.
Yeah, we have those cases. We have them. They'll come to the hospital and then he'll tell you, "Ebu kwanza angalia huyu. Me, I'm not sick because I'm not feeling any signs or symptoms." But in the process, when you talk, you agree, you let him understand. We need to check on him too. He agrees. Yes, he does.
All right. And someone is asking, well, maybe for pregnant women, then you give birth and you probably are having these infections and you're under medication. What happens if you're breastfeeding? Is there anything that would affect that, or are there times when you're forced to limit? And because they argue that most of the medicine that is taken at this point are, or maybe when such scenarios of bacteria are there, antibiotics. And you know how antibiotics are strong. Sometimes you literally feel them in your mouth, after you have taken them.
This is why I'm saying, in case of an infection, please don't diagnose yourself. Okay. Please don't go buy medicine. This doctor will have the idea that you're breastfeeding and you're supposed to take this kind of medicine. The doctor will know. If I prescribe this medicine to this patient, and maybe because she's breastfeeding, we won't have short of milk, she won't have side effects, the baby will not be affected simply because you went to a professional.
Another one is asking, is it true that once you have been diagnosed with a UTI and then you're healed, one, that it is possible you can be healed in totality, or in the event that, well, you are healed, are there likelihoods, or is it that then you are one of the few people who are likely to get UTIs again and again, like you are prone to that?
Yeah, this is called recurrent UTIs, and these UTIs are only treated well, and it's only the doctor who can tell you that you're okay now, you don't have any bacteria. By this I want to say, people take it lightly when you have an UTI. Please, we always advise people, when you're done with the treatment, please go back to your doctor, and the doctor should do a test we call confirmatory test to make sure there's no bacteria in you, because it is not supposed to be recurrent at any point. You're supposed to go to the doctor, finish your medication, take them well, and then we do a confirmatory test just to make sure that there's no bacteria which has left in you. Probably there's a bacteria which has been left, which has not cleared. The doctor will recommend you to go on with the medication just to make sure that the bacteria has cleared in you. That is the only way we finish these UTIs. But now, people make mistakes. You just take medicine, you feel that the problem has gone. The problem is the symptoms, and it has persisted. So you just do away with them. But maybe the bacteria is still in you, it starts growing again.
How important is it for one to finish the dose that has been prescribed to them? Because again, like you said, most of us are notorious when it comes to finishing the doses. So like you rightfully put it, if I take it for a week and I feel like there's some level of relief, then I tend to let go of the dose. Just how important is it to finish the dose? And
I'll come back again to men, because this is the most problem that we have with men. A man comes to the clinic, you give them medication, but when it comes to the weekend, he stops. He'll not finish because it's a weekend. Then he'll skip again on Monday. You know what I'm saying? Because maybe you need to meet your friends and all that, you know. By breaking the medication, you also make the treatment difficult. You're supposed to finish your medication. And if the doctor tells you, please don't take this, don't use this, eat this, try to comply with the doctor. That is the only way. And then finishing your dose, then we do the confirmatory test. This is the only way we can finish these cases of UTIs in the society.
So it's common that sometimes when you get medication for UTI, there are likelihoods that there are things that you'll be told not to eat.
Yes.
For instance?
Doctor will advise
you. Or it depends.
According to your case, and maybe according to the kind of bacteria, the infection that you have.
All right. Speaking of which, what percentage of women, and generally also men, have chances of getting a reverse of the UTI in the event that it has happened?
I would say women.
Sorry?
I would say women.
Women have higher chances.
Yeah, they have higher chances because, for men, chances of them having UTIs, they have their chances, yes. But for women, most women, they don't know. Chances of women going to these public toilets are very high, and then contracting the UTIs there than men. When you check on men, even where they go for the toilets in the public areas, it's very hard for them to have the bacteria, to have the bacteria in them. But for us women, these cases of going to the toilets, public toilets, we bring this UTI so much in our houses or in our homes. But the minute you know how to do it, and maybe how to go about it. By this, I want to say, for a woman, if you're using that public toilet, don't use it like it is your own private toilet
home,
in your house. Don't mess the toilet, but use it wisely. Don't just use it like using your private toilet in the house. But by this, we bring so much infections in the house, and they bring a lot of violence in the house. Because there's no way you'll tell him, I don't know, it is a toilet. They don't understand. But anyway, they don't understand. But now, using those toilets, using these tissues, please, I think we need to talk to women at large to make them realize the dangers.
Right.
Yeah.
Okay. Water. We constantly are told water is everything, and I think we've talked about it briefly, but then again I come to it in terms of relief of pain. Someone says, do you think drinking a lot of water may provide some level of relief from UTI pain?
Yes, like I said.
Okay.
Because the much you take a lot of water, the much we wash our urinary system, the much you pass the urine frequently, and yes, it helps. So
once the diagnosis has been made, you still can have water, and it helps
yes,
a lot.
It helps.
Okay.
Yeah, even on a normal day, even without UTIs, it helps a lot.
Right.
Yeah.
Okay, and now that we are almost coming to a close, what are some of the things that would be of necessity, you'd term necessary to probably advise the people on in such a scenario, and when you probably are handling this and you also are handling another type of disease? And so, yes, like you rightfully put it, the doctor's advice is always really, really important. But in such a scenario, what would be the most basic things for one to pick, and especially on how you handle yourselves at home? I've seen people sharing towels. I've seen people sharing, the shower clothes and all that. I've seen women handling their kids as though it's okay, because after all, this is my baby. I've seen women who've taken their own, inner clothes, and they use the very same inner clothes to clean their baby. And to them, it's normal, because after all, you are a mother.
I would say about personal hygiene. I'll talk about personal hygiene much, even in the house or maybe outside the house. Those personal items, I think it's always good for one to have your own personal item, and again to keep on disinfecting them one time and the other.
Yes.
If it's about the towels, after some time you disinfect them. If it's about the karais you're using maybe for the babies and they're washing clothes, make sure that it's disinfected. And then for us growns, we are supposed to keep on changing our innerwears after some time. It said you're supposed to change them after every 6 months, but most of us don't do that. But anyway, if you're not at the position of changing all of them, you can always keep on disinfecting them. Yeah.
This how important is it for you to change them after 6 months?
Yeah, it said it's supposed to be changed.
It is said so?
Yeah, because of in case of any infection that is growing. Yeah.
Well, that's an interesting one to know. Most people have grown to adulthood without having this information privy to us. So I'm sure you have learned something back at home. So any specific antibiotics that are set for this? Because at least with the general knowledge that we have is that, well, paracetamols and the likes are for pains and headaches, bacteria and all this. Now that we're talking about bacteria, antibiotics are the best. Are there specific ones that one would speak about, and not to encourage people to go and get medicine over the counter?
Yeah, sure.
Yeah.
There's so many, and so many classes, so many different antibiotics, but as long as they are prescribed by the doctor.
Yes.
Because the minute you come, you check on the kind of UTI that you have, we'll be able to know if maybe you're going to prescribe this or that. But the idea of buying from the counter, well, it is okay. Those drugs are there and they are recommended for usage. But now, they're supposed to be used out of prescription. Just go have your lab done, then go buy the medicine. It's okay.
All right.
Yeah.
Would this be equated to what we call yeast infection?
Yes.
It's amongst this one.
Yeah, there's so many. This is why I talked about infections are just so many. There are even yeast infections, there are bacterial infection. It's just broad. When it comes to the UTI topic, it is just broad. There are so many types of infection. This is why I'm saying it's only the doctor who can tell you, who can investigate and tell you what kind of infection that you're suffering, and maybe can be able to prescribe for you. And
so I marched to the doctor's office today, and I give out you know, an overview of what I feel, of what I think,
Yes.
or what is going on in my body that is unusual.
Yeah.
So what are some of the things one should expect in terms of testing to identify whether it is UTI or not? You know, because sometimes some of these things that, you know, the doctors would do would feel uncomfortable. And most of the people will tell you, well, they'd run away from that. Some actually tend to develop more, you know, complications out of the processes. What would be the basic one that you expect from your doctor, so that, again, these other quack doctors would not start taking advantage of such a scenario?
Good. This is now, we talk about consultation. When the patient comes in, you're supposed to sit down with the patient, have your time with the patient, talk, let the patient express himself, and again, let the patient know the kind of problem he's suffering from, maybe the infection is suffering from. Don't make it too fast for a patient not even to understand what is happening to his body. He comes to the signs like, have some discharge, have some itching, I have some backaches, headaches, nausea, vomiting. I'm having, my urine is red, I'm a bloody urine, it is white, it is cloudy, it has all these colors. I'm having pains, I'm urinating so many times. So when you listen to that patient, we'll be able to know if maybe you're going to do a routine, you're going to do an ultrasound, or maybe you're going to have a scan, or maybe you're going to do culture and sensitivities, or maybe you're going to have another higher level of investigation with the people who is going to decide. But we start from the lowest, going up, so that we can be able to know exactly what is happening.
It can get uncomfortable as you go up?
Yeah, it does.
It can get uncomfortable.
Because sometimes we'll even ask for women, we will ask for discharge. For men, we'll ask for the semen.
Okay.
Yeah, to know maybe there's an infection, maybe it has affected his reproductive system, you know. It becomes uncomfortable, and it's good to comply and maybe do it. We finish this once and for all.
That's interesting. And yes, a lot of feedback, which is commendable. But before we close it, is there one thing that you feel like, you know, we'd probably want the viewer to learn on matters UTI, as we call it today?
Well, I think I would want to talk about personal hygiene.
Yes.
That is the most worst hit. And again, about our ways, our behaviors. That's what I want to say, talk about. But again, on any kind of scenario, any type of infection that you could be feeling in your body, we have given the signs and symptoms about the infections in our body. Please don't take it for granted. Go to the doctor, let it be tested, be given medicine, medication, and finish your medication. Then go back to your doctor, do a confirmatory test, and maybe from there we can be able to finish this battle.
Well, that's incredible. I think I also have one on my end. Speak out. Really, there's no harm in going out there and seeking help instead of dying within, because, like the doctor rightfully puts it, the repercussions or the end game will not be something that you will like. Thank you so much, Dr. Caroline Mwai. It was good having you this morning, and we're looking forward to have you some more as we get to learn more on our bodies. Is there any special doctor that you go to if you have these signs and symptoms, or you just go anywhere to any doctor, or you can go to anyone and then they're going to refer you to the right doctor?
Okay, well, maybe not everyone will be able to get to a gynecologist. Maybe uko ndani, mashinani and all that, you know. But it's also always good. We have general practitioners who handle all cases. But anyway, if you can be able to get to a gynecologist, the better. Come.
Come. Oh, are you a gyne? All right. Where do we find you now that you said that?
Well, I'm based in Kasarani. And I have some clinics, Thika and Nakuru. But anyway, you just contact us, and maybe we can be able to help you.
But just how do we contact?
My phone
just
number.
go and Google Dr. Caroline Mwai.
I'm going to give them my number.
Please do as we close it.
Thank you.
I've given you the honor for today only.
My cell number is 0726 331 747. 0726 331 747.
Dr. Caroline Mwai, we always say if it is in our capacity to help, then we'll certainly help. And I'll tell you for free, most of the people are suffering in silence. So sometimes when you get this doctor who doesn't know you, so you just want to go there and hide and tell them your story and then disappear. It helps a lot. So there you go. If it's going to help you this morning, then that is our joy. And on that very note, we close it this morning as we look forward to see you again tomorrow. It was beautiful. It was great. Thank you so much for your feedback. It's always a pleasure. My name is Linda Alela. We lock Morning Cafe on that note to the